While you're doing these x-rays, you got to make sure that your animal stays in true lateral. It's really easy to get them positioned nicely to start off with, but you'll find the more views you do, you tend to lose that a little bit. So the next area that we'll go for is the maxillary premolars and molar. So depending on the size of patient and how many teeth you want to include in the x-ray, that's going to determine the size of film that you want to use. Generally with this size animal, I would try to fit a 4 in there, and with a 4 I can likely get all 4 of those premolars as well as a couple molars too. So let's look at seeing how I can make that happen. So film placement with a 4, you want to push it in far enough so it's actually hitting the palatal side of the teeth on the opposite side of the mouth. Just like that. And again, just stick your paper towel in there to keep your plate or your film in place. Good. Before I get too worried about an angle, as far as my cone, I want to have it directed so it's going to go straight on to that arcade. So you're going to end up being aimed halfway between the tooth and the film, but to begin with you want to make sure the cone is moving at a nice distance as far as being able to go right onto those teeth. So the next thing that I want to do, this is the tooth at the side of the patient. So where I want to be is at the front of the patient. So at the front of the patient, that gives me a bird's eye view to estimate how those teeth are actually seated in the skull. So for a 4 film, I'm getting many premolars, and they're all a little bit different as far as how they're seated in the skull. So I generally pick the maxillary 4th premolar as my one go-to. So standing at the patient's front, the maxillary 4th premolar is going into the skull about like this. So standing at the front, I'm going to use the front edge of my film. So here's tooth. I can see the edge of my plate. So halfway in between being my bisecting angle is right there. So what I'm going to do is I'm going to take my cone and I'm going to direct it onto my bisecting angle. Okay, so you may have to double check a couple times. So there's your tooth. You can see the edge of your film. Halfway in between them is there. And if I have it lined up nicely, then you're going to see that the beam is directed dead onto it. So hopefully that works well to image the majority of the premolars. And again, with the 4 plate, you ideally want to be back a little bit further like this, so that when the x-rays leave here, they'll image and fan out to get all those premolars. Now the tough area on the maxilla is imaging the molars at the back. And the reason why is film placement with these larger plates doesn't facilitate getting that plate back far enough. So if I'm just missing the last 1 or 2 teeth in that arcade, being the molars, what I'll do is use a size 2 plate, or even in our smaller dogs, maybe a 0 or a 1. So again, I fold this extra envelope behind, and what I'm going to do is I'm going to open the animal's mouth as wide as I can and push that film quite the way back there. Okay. Once I'm in the back of the mouth, if I still find I just can't push it back far enough, what I'm going to do is just give it a little tilt like that, which follows the natural curve of the maxilla, and you'll find that'll buy you a couple extra millimeters to get back there. So here's my size 2 plate. So I'm going to push it back as far as I can, maybe get a little tilt, and then push my paper towel in there to keep it in place. So move your cone back so that you're centered on the tooth that you want to x-ray. And then again, same as we did the rest of the arcade, it's a tooth at the side, so you want to be at the front. And at the front gives you the bird's eye view of estimating how these teeth go in the skull. So a tooth back here, go in the skull about like this. You can see the edge of the film is here. So again, halfway in between leaves you about here. Okay, so again, just a little bit of tweaking. Make sure you're centered on the molar that you want. So you'll probably find that you frequently have to keep lifting up the gingiva of the dog to make sure that you're centered on the area that you want. But that looks like we're lined up nicely.